We are here at the Blue Crew warehouse in preparation and celebration of the Ride Pink promotion, where Blue Cross and Blue Shield is going to wrap 10% of the blue bikes with pink stickers to raise awareness for Breast Cancer Awareness Month. There is a very real barrier to healthcare, and one of those things is transportation. And we're really excited as Blue Crew, as a community-run nonprofit, to be able to help support and raise awareness for folks to pedal to receive healthcare. All folks should feel empowered to seek the care that they need. Being able to provide that medium, that way of transportation, is something that we're really excited to be able to do here at Blue Bikes. It's something that we've been doing since we were able to relaunch last summer with a new fleet of 504 pedal assist e-bikes. Throughout the month of October of last year, we provided free rides for folks to travel to and from their COVID-19 vaccination appointments. Last June, we ran a promotion called Ride for Pride, where we were able to raise over $18,000 to support Project Lazarus, which is a local nonprofit that empowers folks living with HIV and AIDS. I really think that the Ride Pink promotion is in line with a lot of our values as a community-based nonprofit.
October is Breast Cancer Awareness Month, and it's really important that we take full advantage of this time to really get up to speed on the important aspects of breast cancer. According to the U.S. Centers for Disease Control and Prevention, or the CDC, breast cancer remains one of the most common cancers diagnosed in the United States. It's usually diagnosed in women ages 50 and older, but even younger women and even some men can be affected too. It really depends some on your personal history, if you've had any issues with the breast in the past, or if you have a family history of breast cancer, especially early breast cancer. So as a company's mission to improve our health and lives of all Louisianians, in October, we really want to take the opportunity to really talk about how absolutely effective and important screening for breast cancer is. There is multiple ways to screen for breast cancer. The most common way to screen for breast cancer is a test called a mammogram. That's a type of X-ray which can be used to look at the breast tissue to look for anything abnormal. So it's very, very important not to wait until you turn 50 to talk to your regular healthcare provider about breast cancer, like I said, because it can occur earlier in some people, and you want to be able to be prepared for that screening process. Also, a really important thing to think about is self-breast exams. Starting at about age 40 or even earlier, many physicians and many national organizations still recommend regular, at least monthly self-breast exams, which can be done pretty simply in the shower. That's a good time to do those self-breast exams. And talk to your regular provider kind of also about that process and really what their recommendations are around what to look for, what kind of things are abnormal, what's normal. Some of that can depend on age as well. So really a good comprehensive understanding of how common breast cancer is, the fact that it can be easily screened for is really important. The other thing to remember is that breast cancer can be treated very, very effectively and in many times cured if it's caught early enough through this screening process. We now know that there is a gene called the breast cancer gene, or BRCA. Some people call it BRCA. That is a gene that circulates within our genetics, which can predispose both men and women to early breast cancer, but it's very, very prevalent in females. So if you have a history of early breast cancer in your family, specifically earlier than about 45 or 40, you specifically need to talk to your regular healthcare provider about possibility of being screened for the BRCA gene or the BRCA gene, because that is something that could significantly increase the risk of breast cancer and some other cancers. So genetics does play a very high role in female specifically risk for breast cancer. As October is Breast Cancer Awareness Month, we have the Ride Pink promotion. So around the city in New Orleans, we're going to have about 50 pink bikes instead of blue bikes. So to really mark the occasion that this is Breast Cancer Awareness Month. So not only is it a great time to get out there and try out the blue bikes and some of those pink bikes, because the weather's getting better here in New Orleans. It's finally not too hot. We're starting to get into some more of the festivals and activities here in New Orleans. So do want to look out for those bikes. Get on those bikes. It's a really great way to exercise. It's a low impact on the knees. It's safe for all ages. Do want to remember to carry a helmet with you. Want to stay safe out there on the roads. Be mindful of traffic. But really, cardiovascular exercise is extremely important. So it's a great way to go out there and get some bike exercise. Cardiovascular exercise not only helps to keep us in a healthy weight, regular cardiovascular exercise has also been shown to prevent many types of diseases like diabetes, high blood pressure, high cholesterol. Keeping a normal weight also helps to reduce the risk of certain cancers. So it is all around a really great idea for all ages.
New Orleans is a great town when it comes to biking. We're really flat, as you can imagine. And with the pedal assist e-bikes, it's something that increases folks' ability to really access different parts of town. Blue Bikes and bike share as a whole came to New Orleans in 2017, and it was originally a push by the community saying, hey, you know, we're seeing this in other cities around the nation. Let's bring this here. Let's really develop this community asset and kind of increase multimodal transportation. So what Blue Bikes is an extension and a natural companion to our existing public transportation system. You can own your own personal vehicle, but you may want to be popping out here and there around town and you don't want to worry about bringing your personal bike. So that's where Blue Bikes and bike share can pop in. So if you're heading out to a restaurant with friends or you're going for a social ride, Blue Bikes is there as an easy, convenient, and affordable way to get around town.
Blue Crew and Blue Bikes are partnering with our title sponsor, which is Blue Cross and Blue Shield of Louisiana, to begin raising awareness for breast cancer. So we have taken 10% of our fleet and we are stickering them with pink stickers to raise awareness about this important issue for everyone's health and hopefully encourage people to get mammograms. At Blue Bikes, we're all about healthy, active transportation for the community and transportation equity. And health equity to us is just another piece of that puzzle. And so it's very important in a community like New Orleans that we continue to raise awareness about all sorts of health impacts here in our community. Blue Crew is the community-run nonprofit that operates and manages Blue Bikes, which is the bike sharing operation here in New Orleans. So we are the locals who put the community and community-run bike share. People may remember that Blue Bikes was formerly run by an out-of-state company. It shut down during the pandemic, and over the past year we have relaunched Blue Bikes under this nonprofit model. We relaunched in August of 2021, and since then our riders have taken over 200,000 trips and they've pedaled over 300,000 miles. So equitable, healthy, and active transportation is really alive and well here in New Orleans. Blue Cross and Blue Shield of Louisiana, they've been super supportive of this healthy, equitable transportation since the beginning. We love having them on board. We also work with the Greater New Orleans Foundation, who sponsors one of our stations, and we work with Entergy, who has sponsored another one of our stations, and then we're a partner with the City of New Orleans. New Orleans has, it's a beautiful city, has a lot of challenges, equitable transportation being one of them. 20% of households in New Orleans do not have access to an automobile, and sometimes the other transit options are not convenient for people. So what we're trying to do is build out an equitable transportation system. We also have challenges here in Louisiana around health, diabetes, heart disease, obesity, and so an active transportation model is wonderful for the city as well. And of course, being in South Louisiana, we all know we're on the front lines of climate change as well, and so converting automobile trips to bicycle trips can really help with our CO2 emissions and things like that as well. As a nonprofit here in New Orleans, Blue Crew, we run on our members, and so if you believe in bike share and you like this mission, we also encourage people not just to buy the memberships, but you can also make donations and support Blue Crew directly at bluecrew.org and make a donation to help us build a better and equitable transportation system. I'm very excited. I'm proud of the team pulling this together. I love that we have sponsors who allow us to do important things like this. And so it just, that's why we wanted to be a community nonprofit. Community Bike Share gives us these opportunities to do these things. So I'm just very proud of the team and grateful to everyone who's helping us make this happen.
Today we're all talking about Blue Bike's October promotion, Ride Pink NOLA, and so we're just promoting breast cancer awareness and making sure that everyone knows they should get their mammograms. Join us in Blue Bikes NOLA for our October campaign, Ride Pink NOLA. So to join, you can post a picture of you on a blue bike and tag at Blue Bikes NOLA. You can also use the tag Ride Pink NOLA, and then you can also make sure that you're following Blue Bikes NOLA to learn more ways that you can get some more entries. Do all that, so you're being entered into a contest to win one of 4 free annual memberships that we're giving out. So we're giving out one every week. But also, if you don't get one of those, we have a lot of lanyard we're giving away. You need to make sure that you're getting your annual breast exam. It's time for you to get one, or you're encouraging your family members to do the same. Cancer is something that can be something that we can all survive. We just have to get the screenings to make sure that we get the treatment when we need it.
We're getting ready to go take some rides on blue bikes that have turned pink for breast cancer awareness. What we really want people to know is when you think about breast cancer, you think about breast cancer awareness, make sure that you are doing the things and the steps you need to take care of your breast health and your health. So schedule your mammogram, have that every year. Do monthly self-breast exams. Really know your body, know your risks. Do you have a family history of breast cancer? Are you at risk? What are the risks that you need to be aware of that you can do something about? So one of the things that you can do is exercise. That's a really important part of reducing your risk for any form of cancer. So getting on a blue bike, taking a ride is going to be a great way. And in October, take a pink ride. In all of Louisiana, our cancer numbers are high, and we do not detect cancer soon enough. We do not have enough women who are getting their mammograms every year. They're not checking in with their doctor on a regular visit. The earlier you detect cancer, the better your odds are for your health outcome to be good. You can treat easier and quicker if you have stage 1 cancer versus if you have stage 4 cancer. And if you are getting your mammograms every year, if you're doing your breast self-exams, if you are knowing your family history and visiting with your doctor and talking about any changes, you're going to detect cancer a lot earlier. You can also make sure you're doing the things that reduce your risk for cancer. Eating a healthy diet, exercising often, drinking lots of water, taking care of yourself and your mental health, knowing your stress levels and what you can do to reduce those, and try to stay calm. Ride a bike. As a breast cancer survivor, I know personally the importance of getting a mammogram, detecting breast cancer early. But for any woman that's out there that's thinking, well, maybe I don't need a mammogram, or I don't really want to know, you do want to know. You want to know early, you want to be out there to treat it. You want to do all those things that your doctor and everybody in healthcare is telling you to do. So make sure you're scheduling your mammogram, grab a blue bike, ride to your mammogram, ride to your doctor's office, or just take a ride.
Breast cancer is important, it's personal to me. I have family members who are survivors, and I think everybody knows someone who's been diagnosed with breast cancer, or a friend or community member. So we want to, number one, be supportive of those individuals, but we also want to raise awareness. We want everybody to take time to make sure that they get their examinations, that they do self-examinations on a monthly basis, but more importantly, that they go get screened on a regular basis, because the earlier you get screened, if you detect it as positive, the more likely that you will survive. So we just want to make sure that we help raise awareness. When you look at Blue Cross, for example, we're a company with 75% women. A large percent of those individuals are African American. Same thing for New Orleans. So we reflect Louisiana, we reflect New Orleans, and we know that because of various reasons, women of color, Black and Latino women, often are not screened until later in the process, which means their chances of survivability go down. So we really want to encourage people to get screened earlier so their chances of surviving go up, because we need all of our people to be healthy and happy to have a good community. October is fall, it's cooling off, so it's a great opportunity to get out and be healthy. You know, we have festivals, we have football games, my favorite. So instead of riding or catching a bus or doing Uber, nothing against Uber, get a blue bike and ride out to your favorite fall activity and be healthy.
I was really excited to see was just the smile and the joy of people hopping on a bike and being able to get outside and enjoy this fall weather. So yeah, I'm excited for y'all to hop on and to pedal with us.